Hi everybody, welcome to the New Teeth Now webinar. My name is Emily. We may have spoke a little bit earlier, or you may recognise my voice from a couple of your voicemails. I do all of the commercial phone calls here and we answer any questions about dental implants, and that is what we will be discussing with Dr. Kirkpatrick today.
Yeah, thank you, Emily. So thank you guys for being with us tonight. And like Emily said, we will be discussing implants and how they can be used in a variety of different ways to help you and the circumstance that you're in. And you'll see from the presentation that implants are a pretty cool item that we have that we can use to replace one tooth, multiple teeth in one area, or even the entire mouth with implants, which we do a lot of. And you're going to see from some of the before and after pictures, you'll kind of get a grip on how we can use them and some of the expectations that you can have with what the result would look like. So I'll go ahead and get started. So about me, my name is David Kirkpatrick. I did all of my school at the University of Kentucky, and my surgery was at the University of Florida in Jacksonville. And I am a board certified oral and maxillofacial surgeon, which is important whether you choose to come here for treatment or you seek an opinion somewhere else. Make sure that the surgeon you are seeing is board certified. That's kind of how we hold ourselves to certain standards. And the people that have passed the oral and written exam, they've kind of met the qualifications. So it's important. And not everybody is board certified. So it's a good question to ask when you're calling to make an appointment. So with implants, they are pretty cool. Like I said earlier, you can replace one tooth or multiple teeth. They are recommended by our National Association as the best way to replace missing teeth. And for those of you that do not know what an implant looks like, which most of the patients that I see for consults think that the implant is like what you see and use. It's like the tooth part. But the implant actually is this structure that you see here that's kind of threaded like a screw. And it goes into the bone, and it gives either us or your general dentist a foundation to put this little shadow that you see here, which we call an abutment, but it's like a post. And that screws into the implant, and it gives us the ability to put the crown on the tooth. Obviously, the picture on the left is before, and this patient was missing one tooth. It was knocked out in a sporting accident. And if you look really close, you can see the indentation in the gum tissue where they were wearing something that we call a flipper, but it's essentially a retainer with a fake tooth. It snaps in and out. It's something that we call it like a party tooth because it's only really used for cosmetics. You're not supposed to eat on it. And they wanted something more stable, more permanent that didn't come in and out. So the options are either a bridge where you crown this tooth and crown this tooth, and you have this crown connected with a fake crown in the middle connected to this tooth. That's a great treatment. It's a quick treatment. It's definitely quicker than an implant. The disadvantage of the bridge is that you end up cutting down good teeth to put the crowns on to cement the bridge. And if you ever have a problem with one of those teeth after it's been cut down with for the crown, then you most of the time end up losing the entire bridge. That's where implants come in as a really good option, because what you can do is you totally avoid the teeth adjacent to the space, and you put one implant in the middle, and a single crown is connected to the implant, which has nothing to do with the adjacent teeth. The New Teeth Now procedure it's kind of a term that we coined here, and I'm sure you've heard in some of our TV advertisements if you've seen those, or if you visited the website. So New Teeth Now means that you're replacing everything in one jaw or everything in your entire mouth. So if you're missing all the teeth, this is what you want. It's the best way that anyone has to replace all the teeth in one jaw or all the teeth in your mouth with a fixed bridge, totally on implants. So we're going to start with a lot of the before and after pictures. And I think it's important for you guys to know that these pictures, they're pictures of my personal patients. So these are people that I've treated. They're not out of a book or, copied from a website. And you can kind of get an idea of what you can expect the result to look like. So if you look at this lady, her teeth, she has multiple missing teeth, multiple decayed teeth. She needed an extensive amount of dental work, which included, it was about a 2-year treatment plan. And she, as is most of our patients, was scared of the dentist. And that's how a lot of these patients end up in the predicament that they're in. People neglect their teeth, and we know that. We understand that. If you're truly scared to go to the dentist, then you avoid doing that because you don't want to go have a filling done or an injection, or some people are just scared to have their teeth cleaned. They don't like the feeling of their teeth being scraped. So people like that who have kind of neglected their teeth and they think that they're at a lost cause and they need dentures, you need to come in and see us, because like with this patient, she was either given the choice of having all of her teeth out and dentures put in, or a 2-year treatment plan to try to save her teeth. And she ended up seeing one of our TV commercials. She came in for a consult. After the CT scan and looking at her clinically, she had plenty of bone for implants, which that was one thing that she was told by one of the dentists that she had seen, that she wasn't really a candidate for implants because she didn't have good enough bone. If you've ever been told that, or you think that you don't have bone, come in to talk to me, because with the CT scan, we can determine exactly where your bone is, how much you have, and how we can put the implants in. And we have special techniques for people that don't have a lot of bone, where we can put in something called a zygomatic implant that actually anchors into the lower part of the cheekbone. The recovery is exactly the same. You don't even know you have the zygomatic implant. But it's a big advantage to give us a way to give you support to the back teeth, especially in the upper jaw.
So we do have a couple of questions.
Awesome.
So I'll go with the one I just got, and they said,
Okay.
Can you tell the difference between somebody that's got zygomatic implants versus somebody that has regular implants? Just looking at
No,
them.
and that's a good question. And I'll preface my answer by saying that in my consult for the patients that need zygomatic implants, I always tell them that even like if you had this treatment done and you moved as far away from Florida as you can get, move to Emily's hometown of London. So, and you see a general dentist in another town that knows nothing about you except that you have an implant bridge. When they look in your mouth, a general dentist can't even tell that you have zygomatic implants.
So even a regular person wouldn't be able to tell the difference?
Correct. The only way that you can tell is from an x-ray. And on the x-ray, they look pretty funny looking because they're longer than a traditional implant and they go in an opposite direction. So they do look weird on an x-ray, but looking in your mouth and the recovery after a zygomatic implant is no different from a regular dental implant.
And can a lot of surgeons do this? Is this a traditional approach to implants, or is this kind of new?
It's becoming more traditional, but fortunate for us, but
Right.
Unfortunately for patients, there are only around about 16 surgeons in the United States that routinely place zygomatic implants. And if you think about that, 3 of those 16 are here in this office,
Right.
which is pretty cool.
And that is for people that have been told they have absolutely no bone, could not have traditional implants. You would use the cheekbone,
The zygomatic
the
implants.
zygomatic implants.
Yeah, and the alternative to zygomatic implants, either you can't have implants placed, or you would need sinus lifts and bone grafts. And, before zygomatic implants were invented or around, or to someone not trained to put in zygomatic implants, your only option is to do sinus lifts and bone grafts. It worked well in the past, but it's an additional surgery, an additional healing time, additional anesthesia, and now with the zygomatic implants, we can still do the same procedure and still do it in one day.
That brings me to the question we had earlier.
Okay.
It asked, this procedure that you're talking about, the full mouth, can be done in one day. What about single teeth? What's the difference? Why can't you do a single tooth in a day, but you do a full mouth in less than...
And that's a question that we hear a lot too. So when we're replacing everything in one jaw, the way that we can put the teeth on the same day It's a temporary set of teeth, but they act and feel just like we want your final teeth to feel. But they're all connected all the way across the arch. It's called cross arch stabilization. So when they're all tied together and you're replacing everything in one jaw, when a patient's chewing on the right side, all of the force that their chewing force is getting translated to all the implants pretty even. So we can get away with putting the teeth on the same day. If you're doing a single implant and a single crown, if you chew on that one tooth is trying to absorb all of the force of chewing, and that doesn't work. You need to let that implant totally heal to the bone before you put the crown on. So this is an example of one of the hybrids. So if you can see that, this is an actual hybrid so it's one big bridge that would be secured on implants. And you can see there's 6 little holes that I'll try to move it around where you can see those occasionally. But the way this works is when this is in your mouth and secured to all the implants, when you chew here, the entire chewing force is kind of evenly distributed. So that's essentially how that works.
Okay, and we actually have a particular question, and it says, I have had my cheekbone broken on the left side of his face. Is it still possible if he didn't have bone? You are also a maxillofacial surgeon, aren't you?
Yes.
So if he's had that broken, would that affect having zygomatic implants? Or would you have to...
No, it shouldn't, because you still, even though the bone was broken, even if it didn't heal exactly in the right place, the bone's still there. It would just change the angle or the position of the zygomatic implant that we would put in. But that's a good question. And I do a lot of full face trauma here at our regional hospital, which is a really busy hospital. So we see a lot of trauma from car wrecks to fights to gunshots to the face. And, a lot of those patients have significant injury to their midface with the cheekbones, but they still, when the bones have healed from the trauma, they still have enough bone that we can put in implants if needed. That's a good question.
Yeah,
and we can determine that from the CT scan, which we would take during the consult.
Okay, so you'd want to bring them in for a consult and kind of determine what needs to be done. And then just back to this, there's not a palate on this.
Correct.
So is that what goes in the mouth?
When it goes in the mouth, it's essentially just a horseshoe-shaped bridge that replaces all of the teeth from right to left. So kind of everything is replaced. It's screwed in, it's fixed in, so you can't take it in and out. There's no wings that kind of go up underneath the cheeks or the lips with a denture or a partial, and there's nothing covering the roof of the mouth.
So it's much easier to speak with something like that.
It's significantly easier than a denture or a partial to speak, eat, and it doesn't affect the change in taste that can come along with some of the removable partials and dentures.
Very cool.
This is how we do that. And kind of the little model that I was holding up earlier. So this is showing a lower hybrid bridge. And the reason it's called you'll hear me talk about a hybrid a lot. But if you look at the picture, it's not just teeth. There is a little bit of the pink gum material. And that's on there for two main reasons. One is that we always want it to look good. So every time you're smiling or talking to someone in public, when they look at your teeth, you're just seeing perfect, pretty gum tissue. Because if most people, if you're in need of significant dental work, you've had periodontal disease, or we're doing a lot of procedures with implants, then the gum material, your natural gum, is not in a perfect spot. So if you only did individual teeth there, the gum's never going to look good because you're going to be missing those, I call them like my pretty pink triangles. If you look back at the picture, so if you look at these little pink triangles in between the teeth, if those are missing, it attracts people's eyes. So when they look at you, if you see someone smile and they've got periodontal disease and that pink triangle's gone, then there's a dark shadow in between the teeth, and it's very perceptible to the eyes. So this, putting this material there makes this bridge always look good. The other reason it's there is to kind of give it a little bit more support so it's a nice, strong bridge. All right, and then this is showing what it would look like on an upper jaw. And like Emily was talking about earlier, you can tell there's nothing covering the roof of the mouth. It's one thin horseshoe-shaped bridge, and it's screwed in with these little micro titanium screws. That's how it's stabilized and screwed to the implants.
So on that demonstration, you see how there's 4 implants. One of the questions that we had in on the chat was asking, all the other doctors are advertising this all-on-4 procedure.
Okay.
And after they've done their research, and as you were explaining earlier, we sometimes do 6 or 4 to 6. Why do we do it that way, and other doctors are not doing it that way, was one of the questions.
So the implant company that we use is called Nobel Biocare. And it's the largest implant company in the world, which is one of the reasons we use them. The other reason is they are the only company that makes zygomatic implants. And that's how we know who's doing what in the world of zygomatic implants. The other reason, which is the main reason, is they have the best implants. And they're the ones the company developed what's called used to be called the all-on-4 technique, where you would replace all the teeth in the upper jaw on 4 implants, all the teeth on the lower jaw on 4 implants, and that's pretty much all you needed. Now, the more we've learned about it over the past, this procedure's been out for about 30 years, that the upper jaw and lower jaw, the bone quality is different. The lower jaw is a really hard, dense, thick bone. The upper jaw is not as hard, not as dense. 4 implants works in some people in the upper jaw, but most of the newer studies and the research is showing that if you can get 6 implants in, 6 is better on the top. 4 is still plenty on the bottom because just the density of the bone. Most people don't need, there's not even room to put more, but the bone's so hard and dense that you don't need more. But with the upper jaw, actually, I've never done a case on just 4. All of my patients get 6 because I'm a little conservative. And I would like to know that the implants that I put in, patients are going to have for a very long time. And, the goal is for you to have these things forever. And I feel like with 6 good, strong implants, my patients will.
But a minimum of 4 is okay.
A minimum of 4, 6 is better.
Got you.
All right. So what happens when you call and you schedule the first appointment? It'll obviously be for a consult. And it's about an hour appointment. And it's with one of our implant coordinators. And they'll talk to you for a while. They'll get it's called on the screen. You see it's called an iCat, but it's a CAT scan. So from the CAT scan, it gives me an idea of what you look like on the inside. So I can see the bone that you have, the location of the bone, and when I'm showing you the location of your bone, I pretty much develop a treatment plan, looking at your CT with you, and determine exactly where I'm going to put your implants, and pretty much even the size of the implants that I'm going to put in. So that's a cool thing, having the CAT scan and setting and discussing your situation with you during the consult. So one of my patients, before picture, obviously this is not his hybrid, but if you look, he's got multiple gaps between his teeth. He's got, this tooth is broken. That is an abscess that's kind of eaten its way through the bone and now draining out of the bone into his mouth. And he came in, his family talked him into coming in to see me for a consult. He was considering either remodeling his house or they talked him into fixing his teeth. So he came in, talked to me for a consult, and he had plenty of bone for implants. We developed a treatment plan, got him set up for the procedure, and that's his after. And Emily, if you look at that, that's a huge difference.
He doesn't even look like the same person.
No, he doesn't look like the same person. And he's a very outgoing, one of the nicest people you'll meet. He was always smiling, even before he had the procedure. Now when he comes in the office, and he's about 3.5 years out of surgery, and he still comes in for follow-up checks every now and then. He's got a new shirt, new hat on every time we see him, and he's showing everybody in the waiting room his new teeth, just smiling.
That actually answers one of the questions that we got in, and I was going to interrupt you, but somebody was asking about maintenance and checkups, and if we have a local dentist that would assist with that, or, I mean, I know that we include checkups, correct, for 2 years.
Yeah, so these are warranted for 2 years, which includes the maintenance, which is a big advantage to you guys. But we do have a restorative dentists that work here, and they can maintain these. So after during the 2-year process, it benefits you to come here for all the maintenance. After the 2 years, and this is mainly for our out-of-town or out-of-state patients or out-of-the-country patients, you can see a restorative dentist in your hometown. Anybody who is competent with implants can clean around these hybrid bridges. Most of our patients, though, they end up liking a restorative dentist, Dr. Nafala, so much that they still come back to see him for their 6-month checkup. And usually his protocol is every 6 to 9 months, depending on how the patient's doing with their hygiene. He'll see them, check everything out, make sure the gum looks good. Occasionally he'll take the teeth out, steam clean them, which I love how he talks to the patients about it, but he relates it to like having your car detailed. So you go in, patients come in and they have their teeth detailed. He takes it in the back, any stains that you've accumulated, because they act just like natural teeth. If you drink a lot of tea, coffee, smoke, tobacco products, these teeth will stain. Not as severe as what natural teeth will, but they do. But it's easy to clean off. So when you go in for your cleanings, he takes the bridge out, takes it to the back, steam cleans it, knocks off all the stains, any calculus that accumulated, puts them back in, and they feel brand new.
So whatever colour you get your final set of teeth in, you want to make sure you like it, because it's going to be with you for the rest of your life, basically. After it's all cleaned up, it's back to that colour. So our gentleman here has lovely white teeth.
And they look incredible.
They do.
And that's the other cool thing about the procedure is you can pick out, you do pick out your teeth. You pick out from the size, the shape, the color, and because everything's kind of individualized. We don't have anything stock here. Everything is made specifically for you. So another one of my patients, and if you look at her, she was involved in a motor vehicle accident at a younger age, and it broke off the front teeth in the upper jaw. She had kind of a snap-on appliance that replaced them, but she wanted something that was more fixed and that she could feel good about. So she came in, she had plenty of bone, once again, that we could find from the CT scan. And that is how she came in one morning, and that's how she walked out. Difference. It significantly improved her self-confidence and made just a huge impact in her life. Before, if you look at this before picture, this is one of my younger patients, but if you look, he's got the little red line around the gum tissue here. That's gingivitis, periodontal disease. But his main problem is just, this is caused, and it's one of my favorite drinks. I like Dr. Pepper. But
me too.
Dr. Pepper, Mountain Dew, if you sip on this all day long, the acid in it just constantly wears down and eats away at the enamel. And, this is what will happen. So he still had plenty of bone for implants. We took all the teeth out, put in implants, and that's him the day of the procedure, actually. And if you look real close, you can actually see some of the red stuff there. That's a little bit of blood, kind of dried blood in the mouth. But I put this picture in to show you, and all these bridges are different. But if you look at this, I've got cheek retractors in, which are the silver structures that you can see here. So we've really got the cheeks spread out a lot wider than what it would be if you were smiling or laughing. But I want you to see kind of, these are different thicknesses on every, some are real thin, some are really thick. People who are missing a lot of bone, then these are a little taller and thicker. But if you look at the junction here, whenever, like in this guy's case, when he's smiling, I never want him to show the junction right there, like where the bridge meets your natural gum. And I will tell you that, you know, these are the ones that we put in the same day. So you get 2 sets of teeth, a temporary set and a final set. The temporary set is made of acrylic, which is what you're looking at in the picture. The final set is made in zirconia. And there's a big, big difference between the two materials. Zirconia, a lot of general dentists are making individual crowns out of zirconia, and they have been for a long time. So it's a time-tested material. It's very strong and very cosmetic. So the acrylic that you get for your temporaries used to be the final before zirconia was available. But now that we have zirconia, just the cosmetics, the feel, and the strength of it is kind of unmatched with any other material. So that's what you get with the final set of bridges that would be put in, fabricated and put in 6 months after the implants have been placed.
I actually got a zirconia crown today.
Oh, I know, I heard about that.
And it feels, that was one of the things that I said.
Let's check it out.
When
Let's
he,
see. It's right.
when he,
Let's see. Right where the green dot is. See that nice, pretty zirconia
we
crown?
should get Ted to zoom in.
Yeah.
But the one thing that I did say when it went in, because I had my temporary crown changed, was the feel of it. It just feels so much like a natural tooth.
Yes.
It was very, very smooth. It was normal. It felt like I was back again.
And that's a really cool thing about zirconia, because they can put specific anatomy to make them look exactly like a tooth, which is important, you know, from a cosmetic standpoint. And even, you know, with Emily, just with it being a back tooth, just to run your tongue over the top. I mean, it's important to have the feel of the little kind of the rough, sharp edges that natural teeth have, and which are what give you the ability to chew and tear through food. All right, so why do you do this procedure? Why do people choose like the New Teeth Now procedure? The number one reason should be to restore total body health. That we know, and I'll talk about in an upcoming slide, periodontal disease is a serious thing. It's not just bad breath, bleeding gums, and, you know, some cavities. It really can affect the entire body. So if you have periodontal disease, you do need to have either come in and let us check you out, or any general dentist, I mean, just to get kind of an idea of where you're at, because you want your mouth to be in good health. Because if your mouth is not healthy, then your entire body can't be healthy. Definitely can improve your self-confidence. I mean, it's easy to see from our before and after pictures. Brings out a smile, improves your ability to eat without pain, sleep during the entire procedure. So when we take out the teeth, put the implants in, and put your temporary teeth on, you're asleep for the entire procedure, which is huge for our patients who are scared to go to the dentist. And the post-operative pain level, I mean, it surprises us every day, so we know that it's going to surprise you. So the oral body connection, one of my favorite quotes that I use a lot is, the mouth is the gateway to an awesome creation. If you think about that, you know, every time you breathe in air, chew food, the mouth is the first thing that comes in contact with that. And it, you know, the air you breathe and the food you eat is pretty much what keeps you alive. So it's important that it's passing through a clean, healthy environment. Periodontal disease will increase your chance of heart attack. Mayo Clinic has put out several papers that kind of prove the relationship that periodontal disease can have on your cardiovascular system. Increases your chance to have a stroke. For women, low preterm birth weight babies, diabetes, osteoporosis, you can read the list. You know, the respiratory diseases and the digestive diseases, that's kind of what, when you're breathing in, if you've got a mouthful of bacteria, no doubt droplets of bacteria get sucked into the lungs, and it can exacerbate COPD and other respiratory diseases. But the bottom line is, the longer your body is trying to fight a low-grade chronic infection like periodontal disease, it will reduce the effectiveness of the immune system, which can shorten your life expectancy. So it's a pretty serious thing.
To interject, periodontal disease is or can be considered genetic. It's not just because somebody hasn't taken care of their teeth, correct? Would you say if you've got a history of it?
It's a yes and no answer.
Okay.
Yes, genes can play a role in the virulent bacteria content that you have in the mouth. But a lot of times, or most of the time, it's from neglect where, and I mean, I'm in the profession and I don't floss my teeth every day.
Me
So
either.
most people, when you really come down to being truthful about it, if you don't floss every day and you brush at least twice, at a minimum of 2 times a day, it's a slow process. Periodontal disease is something that once it starts, it can be painless. So you never know you have it. And it just kind of sits and it's a low-grade infection that will slowly melt away the bone that holds the teeth in.
So it's irreversible.
So a lot of people, once it gets to a certain point, it's irreversible. You can stop the process before you get to a certain level. The pocket depths when a general dentist or their hygienist is kind of measuring the pockets around the teeth.
Mm-hmm.
Until they get to a certain depth, it can be treated. But once it gets to a certain depth, it's the only way to treat it is to take the teeth out.
But that gets rid of it and you're no longer fighting that infection.
Yes, and that's a really cool thing with this procedure, because the day you come in for the procedure and I take your teeth out, that day your periodontal disease is gone. So if you want to be truly healthy, you must restore your oral health. So who's a candidate? If you have no teeth or you're unhappy with your dentures, a mouthful of bad teeth, severe periodontal disease, especially if you've ever been told by your general dentist or another oral surgeon for that matter, we see patients every day for consults that have been to 1, 2, 3, multiple other dental specialists, from periodontists to other oral surgeons, and they'll tell them, like, you're not a candidate for implants. You don't have enough bone. And then they come see me and sit down and talk to me during the consult. And, most of the patients don't tell me this up front. So I'll go through their CT scan and like, oh yeah, we can do this procedure, no problem. You do need zygomas, but you've got plenty of bone in all the right places. And, the patient will be sitting there looking at me. They're like, I have like 3 heads, like I'm crazy, because they'd been told by other specialists and professionals that they didn't have enough bone. And then I'll walk in the room and say, oh yeah, we can do this. No problem. You've got plenty of bone. And they're like, well, I've been told by 3 people I don't have enough bone. So it's important. Make sure that wherever you go, they do a CT scan. Without a CT scan and getting that true 3-dimensional picture of the bone, there's no way to tell you if you're a candidate for implants or not, or if you have enough bone. I've been here for 9 years, and I've never had a patient that didn't have enough bone or that we couldn't do this procedure on.
So you've definitely done enough patients to know. I know that we do at least 1 a day between 3 of you guys.
Yes.
So you've definitely done enough to know that.
Yeah, and I think on average I'll do 2 to 3 of these procedures a week. And, over a 9-year time frame, that's a lot of hybrids. So we've seen pretty much as bad as it can be. And we've seen patients, at their worst when they're really scared. And matter of fact, they don't even want to be here. But it's cool to see them, even that patient that is just terrified to be here, and they don't want to come in. And I've had patients to sit out in the parking lot and be sitting in their car, and we call them like you're supposed to be here at 7. We're starting at 7:30. Where are you at? And they not answer the phone. Then they walk in and say that they were sitting in their car 20 minutes because they were, even though they had worked up the courage to come in and had everything set up for surgery, they were scared to still come through the front door the day of the procedure. But that same patient when you see them back for their first follow-up appointment 2 weeks later, is just a changed person. And they're excited. They're so happy they had it done. And I mean, it truly can change, the way people feel about themselves.
Even immediately after the surgery, as soon as they look in that mirror.
Oh,
isn't
yeah.
it? It's like tears.
We put the
just...
teeth in at the end of the day, hand you a mirror, and you get to see what the teeth look like. Now, you are numb because I give you a long-acting numbing medicine at the end of the procedure right before you wake up, which benefits you. It makes it pretty much pain-free. So when you wake up, there's no pain. So when we do hand you the mirror right when the teeth go in, some people can't get their lip up. They can't smile because they've got that numb feeling. But it is cool to see patients to look and just, they'll start to examine the teeth and look and they get that smile and just kind of like, you can tell that they're appreciative. So with this patient, so she came in initially interested in implants and replacing her teeth. And she was having pain with her teeth. She was given the option of restoring the teeth, but kind of like that first patient I showed you, it was going to be a very long, drawn-out treatment plan. She was also given a treatment plan for upper and lower dentures by another dentist, and she didn't want anything to do with anything removable. So she came in for the consult for implants. While she was here, another part of my practice is I do full face cosmetics. So facelifts, neck lifts, nose jobs, eyelid surgery, CO2 laser resurfacing procedures. And she started asking about that during her implant consult. So what we ended up doing in one day is taking out the upper and lower teeth, putting in implants in the upper and lower jaws, new teeth on, and a CO2 laser resurfacing. I mean, if you look at the difference in before and afters, the sunspots are pretty much gone. Fine lines and wrinkles were immediately improved. So literally she came in and walked out looking like her younger sister, which is, cool to see the transformation. Before and after, same thing, been given a treatment plan to have his teeth removed. And his teeth don't look that bad in the before picture, but he had significant periodontal disease. So we ended up taking the teeth out, implants in, then the upper and lower jaws, and the new teeth there. And this guy, I'll tell you a funny story about him. When he came in for his first post-op appointment, he referred his next door neighbor, came in for a consult around the same time. And he was like, "Oh, I'm sending my neighbor in to see you." And he goes, "I'll tell you why he's coming to see you in particular." He said he walked by the day after I had my procedure. I was sitting on my front porch reading the paper, drinking a cup of coffee. And he said my next door neighbor walked by. And he was like, "Well, I thought you were having surgery and having all your teeth out and implants in and new teeth put on." And he goes, "Well, I did." And he goes, "What? Like, you don't look like you've had anything done." And he said, so I was showing him, and he couldn't believe that, he was sitting out, no pain, drinking a cup of coffee, reading the paper. So that guy scheduled, came in, and he had upper and lower implants put in.
So you went in yesterday, and then the next day,
he
sitting there chilling.
was fine. Which is pretty common, story that we hear from our patients. So another before and after. This is the reason that you have the pink material on the hybrids. If you look at this is just one big bridge. So it's the same thing as the hybrids, except it's on natural teeth, and there's no pink material. So if you look at this, the gum has shrank up so much that the dentist who did this, and it was done in Mexico City, that they had to make these gargantuan teeth. I mean, when she came in for the consult, she smiled, and I saw big teeth. And then I pulled her lip up as I was doing my exam. And it's like, the more I pulled the lip up, the more teeth I saw. And it was like looking into a black hole. You never knew where you were going to get to the end of the teeth. And finally, I stretched her lip up tall enough that I could see the end of the teeth. And it was just like her gum was in terrible shape. The bridge you could literally take and rock up and down with your fingers. I mean, it was totally failing. She had very little bone anywhere in the upper jaw, but she had great bone for zygomas, and that's what we did. So we put in zygomas, and this is her bridge. And these teeth, when you, even looking at the close-up with the lip retractors, and these are acrylic, so these are temporary. It's not their zirconium bridge, but this looks 1,000 times better than this. And when she's smiling, you see the nice little pretty pink triangles coming down in between the teeth, and it just looks natural. And then here's another patient. She's pretty special to me in this office, but she's a school teacher. She ended up coming in for a consult. What actually drove her to have the procedure was she's in education, elementary education, and if you want to know the truth about something, ask a kid. And she had some kids that would come up to her, and they weren't being mean, they just didn't know. You know, they would ask her like, Miss Jones, why are your teeth so brown? Or why are there dark spots around your teeth and gums? And it really hit home with her. So she came in, had the procedure, and that's her after. And she liked them so much, she invited our mastermind, Ted, to come to actually her school where she teaches. And, you know, that's her and her atmosphere. And you can tell that huge difference in the way that she feels about herself from her smiling, how she can interact with people and kids. And then here's another patient before and after. And this kind of shows the whole gamut of what we see. So broken tooth, decayed tooth, missing teeth, teeth that have no partners to kind of hit against or, you know, work with on chewing. So these teeth end up dropping down. You can see they're down below where the level of these teeth. And he really had no other options except either dentures or implants. And that's him after. This lady, these teeth look good because it's a denture. Comes in and out. She puts it on a table beside her bed every night. And she was tired of having teeth that come in and out. This is her temporary teeth that's secured with nothing covering the roof of the mouth. And she can't take it in and out. So before and after periodontal disease, this is one of the images that we get from the CT scan. You can see this is showing the upper jaw. This is the lower jaw. And if you look really close, just the tips of the roots are in bone. That bone level should be up here around where the arrow is. But still had, even with all that bone loss, the patient still had plenty of bone for implants that we could find with our CT scan. And there's the after. Another patient, 7:30 a.m., he came in, we were getting ready to start the procedure, blue t-shirt as the clock goes forward, 4:30 p.m., same blue t-shirt. This is how he walked out that day. And if you look really close, there's a little purple mark there, purple mark there. That is from a surgical marking pen where I measure certain distances to make sure that we put the teeth in the perfect place.
Should be called teeth in hours.
It
Really?
is.
Yeah.
Really, it is teeth in hours instead of teeth in one day.
We had a question actually on the chat, and they said the reason I was asking it is obviously we do it in hours, 7:30, 4:30, 5, they're kind of leaving.
Yes.
Do we have any hotels and facilities available to them? And if you want to just explain that you do want somebody with them at the procedure.
Sure. So we see a lot of patients from out of town, other parts of the state of Florida, other states.
Countries.
We have people coming in. I've got patients from several other countries that fly in mainly because of the zygomas and, you know, the limited amount of surgeons that are trained to do this. So we do see patients from all over, and there are a couple nice hotels that are just like a mile down the street. They're really nice areas with some nice restaurants around. So we do have hotels that are very convenient to the office. And as Emily was saying, you know, the procedure's done under a true general anesthetic. So you're completely asleep when you have this done. That, for your benefit, there's no pain. You wake up and it's finished. The flip side to that is you can't drive after being under general anesthesia. So you do need to bring somebody with you, and we want them to be able to stay with you for the first 24 hours. So, with the hotel being really close, they can stay with you at the hotel. We can arrange transportation if needed. We do that occasionally. But it's most people, when they come in, stay at the hotel down the street and then come to the office first thing in the morning. This picture, so this is showing an up-close picture of the temporary hybrids. So these are acrylic. That's him before anything. And then this is him with his final set of teeth. So he went, and with the temporary and the final set, one of our implant coordinators tells patients that just look at it as like your test drive set. So you get the temporary set put in, and you kind of wear them for 6 months while the implants are healing. And then you decide whether you love them or if there's something you want to change. And if there's anything you want to change, you can change the color, you can change the size, you can change the shape of the teeth. And, some people do that. We try to get it to where when we put in your temporary set, that they're everything that you dream they would be. And I'm serious about that. We try to get the temporary teeth to be perfect for you. So when you come in 6 months later and it's time to get the final set of teeth, you tell us, hey, I love them, duplicate them in the zirconium material. But occasionally patients will want, like this guy. He came in, with his temporary set of teeth. He kind of went conservative with the color. If you look at his before picture, his teeth were pretty yellow. He did not want to go straight to just a really bright white tooth. So he kind of went in between. But the more he wore them, he's like, you know what? On my finals, I want the teeth to be bigger, and I want them things to shine. So he did, and they look incredible on him. We thought the temporary teeth looked good, but he wanted them bigger and brighter, and that's what he got. So there's his temporary set, and there's his final set. Up close, up close. So dental implants, they also can be used to help secure dentures. So if you're not ready to transition to the full arch implant retained bridge, which is secured in that can't come in and out, you can have a couple different implants, and it's usually, we do this on the lower jaw, where we put in 2 implants and they can be used to secure the lower denture. And this is what it would look like. It's still a regular lower denture, still the same size as the denture, still got the wings that kind of sit down like saddles over the lower jaw, but it snaps on. It's a lot more secure than what a regular denture is, but it still comes in and out, and you still treat it like a denture. So with dental implants, they'll never need a root canal. They'll never decay. They're easy to maintain. You brush them just like you would natural teeth. So what I recommend patients getting is a Sonicare toothbrush, which the way the little toothbrush head quivers and vibrates, it does a really nice job brushing underneath the bridge. A lot of my patients will also get a water pick. They have them now, which are very cool, that even hook into the shower head. So when you're taking a shower, you can actually just kind of flush out the teeth in the shower, so you don't make the mess of a water pick. But they're easy to maintain. Brush them a couple times a day, water pick if you want, and then you go see my restorative dentist, Dr. Nafala, to have them cleaned every 6 months, just like I do with my natural teeth.
You can use a water pick on your natural teeth too, can't
Yeah,
you?
and a water pick...
It's not an abnormal thing to have.
Correct. A water pick is, even in some of the research now, I'm not a real big believer of a water pick totally taking the place of dental floss, but it does do a really good job at kind of flushing from between the teeth, which just brushing cannot get to. So dental implants, they will allow you to eat what you want. They definitely improve the quality of your life. And like I was saying earlier, when you come in for a consult, you'll meet with me and one of my dental implant coordinators. This is Shauna in the blue shirt, Debbie in the black blazer, and both are very knowledgeable. They've been doing this for a long time. They both actually were surgical assistants here, so they've assisted on the procedure, which helps them kind of talk to you about the procedure because they've seen it done several times. This is me and my surgical staff, Corey, Amanda, and Shirley. And, I put this picture in here because I think it's important for you all to see that these are the people that you'll be working with. When you come to see me, you're going to see me and one of these three girls every time you come in. You're not going to see me for the consult, another surgeon for the procedure, another surgeon for the post-op appointments. You'll be my patient and with this team. So we kind of really personalize the treatment. We get to know you, you get to know us, we build that relationship. So, and we want to do that. So we watch and follow you during your transition. So when you leave with your final set of teeth, we get to see that transition. Dr. Nafala, this is my restorative dentist that I work with. He's a really good friend of mine that I've worked doing a lot of different surgical procedures with. The reason that I do it with him, not only is he very competent, but he's very compassionate, and you'll know when you meet him, he really cares about his work and his patients. He wants you to be happy, and he wants when you're out and about in the world and somebody brags on your teeth, he wants you to be happy that he's the one that made those. And that's important. Our anesthesia team, if you look at the names, pretty self-explanatory. Who else would you want putting you to sleep besides Kim Cherry or Jack Daniel? And that's his real name. And then this is our office, which is located in Lakeland, which I hope you know that by now. But it's, if you look at the building, this is the surgical center. We have ORs, and this is part of it where the lab is upstairs here where the teeth are actually made. So everything is in-house, from the restorative dentist helping you pick out the teeth and getting everything set up, to the lab that actually makes the teeth, to the surgery ORs that are in the building. And then once you get once the final teeth are being fabricated, they're actually milled out of zirconia and stained to your color in the building. So everything is made here, which allows us to have total quality control of the product that we're producing, which for you as a patient, it can't get much better than that. Because you're not going from one office to the other and having the teeth made in like a lab in California, which we have a lot of patients that tell us that, that they went to a surgeon to be evaluated for a procedure similar to this, but then they were going to send them to an office down the street, and then they were going to send the teeth to a lab in California, and hopefully not, but I've heard send the teeth to China to get made. We want to keep everything here, made in the USA, and it's actually made in Lakeland in our office.
In front of you. Literally.
Yeah, and it literally has to pass
your standards.
Actually, I'll take me out of it. It has to pass Dr. Nafala's quality control check, which if it can get by him, you will be happy. So thank you guys for being on here. Hopefully it was informative. And if you have any questions, you can call the number and schedule a consult.